The EKO-Model provides empathy, knowledge, and care to women with a health issue during their reproductive life. This approach to caring requires that the healthcare workers are knowledgeable in order to confirm that a patient has suffered a miscarriage or an intrauterine fetus death. There is a research that demonstrates that when the EKO-Model is applied, patients feel that they have received the appropriate professional care when they need it. I'm from working in Sweden and in Norway as a midwife and PhD in obstetric and gynecology and as a professor. Empathy. The empathy having a mental ability to understand and sympathize with others. Having the ability to feel empathy means that you can experience and understand the feeling of others. Affective empathy allows the caregiver to feel what the patient is feeling. Cognitive empathy enables the caregiver to understand what the patient is feeling. Healthcare workers must be competently knowledgeable when working and interacting with women and their partners who are experiencing the loss of a pregnancy. Intimate knowledge regarding what happens when a patient is undergoing miscarriage or another sickness. With the knowledge of different symptoms, emotional reactions, necessary measurement, the caregiver can enable the women in completing a miscarriage or giving birth to an optimal medical manner. Caring aims to help a person to plan and implement action relating to daily life in order to improve health and fitness, prevent illness and disease, and to restore and maintain health and fitness. Right from the first contact with a woman who has experienced a pregnancy loss, it is very important that the caregiver can offer an individualized care based on her needs. When a patient is given clear signal about specific needs that they have, the caregiver as a trained professional respond to the patient by giving empathy, the use their specific knowledge and provide the suitable care technique. Swanson's middle-range theory have had great impact on my research. And she says Swanson middle-range caring theory is an effective, sensitive guide to clinical practice with women who have experienced a miscarriage. The theory includes 5 categories of the therapeutic caring process, which are maintaining belief, knowing, being, willing, doing, and enabling. The category has the following definitions. Maintaining belief, sustaining faith in others' capacity to get through an event transition or face a future fulfillment. Maintaining belief is the basis of practical health care. Knowing, understanding an event as it has a meaning in the other's life. Being emotionally present to the other. Doing for the other as he or she would do for themselves if it was at all possible. Enabling is defined as a facilitating the other's passage through the life transition and unfamiliar events. Sexual reproductive health is well known for all of you here, and several empirical studies are provide and give us knowledge of like different caring situations, how the women and her partner experience the situation and the different treatment situations. And this is the base for the knowledge in the specific situations. The miscarriage. 20 women who become pregnant are faced with a statistic failure rate of approximately 20%. Pregnancy is verified by a pregnancy test or an ultrasound examination. Early miscarriage is defined as a pregnancy that terminates before week 13. When a pregnancy terminates between week 13 and week 22, is referred to a miscarriage. Symptomatic bleeding may occur as follows. Light bleeding can be treated as a way to see condition. Dark bleeding could be seen as a missed abortion. Heavy bleeding should be reacted to as an acute situation, and the women should go to the emergency clinic without delay. Acute pain demands immediate attention. Light bleeding and some less pain may occur in up to 50% of normal pregnancy. The cause of miscarriage is always a major concern for the women, and chromosome defect is the major contributing factor, as it is responsible for up to 80% of all miscarriage. Chronic disease such as metabolic, diabetic, endocrine or under or overactivity or thyroid condition, medication, obesity or malnutrition, immune system issue, uterine abnormality, age or previous miscarriage, environment factors. There are 5 basic type of miscarriage, not one. And early miscarriage, a miscarriage that occurs before week 13. Complete miscarriage, all of the remains of the terminate fetus are ejected from the uterus. Incomplete miscarriage, remains of the terminated fetus must be removed either surgical or with medication. Missed abortion, a fetus that have expired and has not been diagnosed and terminated. Ectopic pregnancy, where a fertilized egg has found its way into the fallopian tubes and must be removed surgical or with medication. The different types demand different care. The treatment, largely a matter of resolving her emotional issue and her grief. Treatment may have to do with her pain and physical suffering. Most of the time is not life-ending event. Women need to have a confirmation that the miscarriage has indeed occurred. Women typically goes into a normal grief reaction, which is the most important element for her post-event care. Losing a pregnancy is emotional challenge, feeling of guilt and emptiness, grief and sadness, physical and emotional numbness, difficulty in sleeping and concentrating, eating and digestive disorder, weeping and crying. Losing mourning their loss. Each woman has her own individual way of seeking resolution to this loss. She is provided with oral and written information regarding the subject of miscarriage. Some women may be in need of additional counseling and emotional support depending upon their ability to cope with their loss. A routine follow-up visit with a midwife is a standard with the EKO-Model. when appropriate contraceptive may be prescribed, along with advice regarding future attempts to become pregnant. An abnormality in bleeding patterns should be resolved, and a pregnancy test should be administered in order to confirm that the miscarriage is complete. Will colleagues Professor Swanson and Wojnar, we have developed a model what the women go through after a miscarriage. They're coming to know, they're losing and gaining, they share the loss, how to go in public, processing through it, and become pregnant again. And it's even a lot of small experience, getting pregnant, bleeding and cramping, picking it up and remain, feeling cramps, creating a memorial, resuming menstruation, and preventing fears. So the structured appointment with midwife interviews is important, and to discuss the experience of the miscarriage and the feelings about the event as you see in the picture before, the women's bleeding pattern and the pregnancy test, things of complication identify, if thing of complication is identified, contact with a gynecologist for an appointment is necessary. Consult women that the need of contraceptions in planning or a new pregnancy. Advise, wait for resumption of menstruation. And of course, documentation in the journal system. It's about miscarriage, and it's all women issue who has impact in the sexual life, and it's close connected with the miscarriage and women's experience of the care. Women who did not participate in pap smear test screening. There were 3 categories of reasons excuse that the women identify as the reason for not participation: communication, treatment, and subterfuge. Apply with the EKO-Model, they will be treated with professional treatment, respectful and sympathetic manner through the whole healthcare system, efficient organization, and clear communication. Obese pregnant women with a body mass index above 30. Midwife responsibility to inform them about the potential risk during their pregnancy without judgment regarding their being overweight. Women living with the obesity feel do not conform to the societal ideal of an attractive woman, prejudice regarding the obesity. When an obese woman becomes pregnant, they may feel more comfortable with their standing in the society, happy explanation for the size of the abdomen, happy and proud about their size. This gives them a sense of full life and belonging. Morning sickness during pregnancy. nausea during pregnancy affect about 10% of all pregnant women. The result of the study show that women who suffer from morning sickness during pregnancy feel loss of control over their lives, significant impact on their mental and physical health, difficult for them to function normally, feeling of isolation, loneliness, and alienation. Essential that midwives are attentive in order to provide the help and support that these women require. Mothers need support, expectation of the BVC nurse at the first home visit. First time Malle experience uncertainty in a new role as a mother and caring for a baby. Parents seek support from the babysitting nurse. Parents expect the midwife behavior and attitude towards them to be friendly and professional. The mother's need for support to develop as a parent and to feel secure in the parental role was requiring. Midwives' experience of using intuition as a motivating element, conveying assurance and care, and there are organizational professional condition, the communicative ability of the midwife, and the reflection emotional competence of the midwife. How the healthcare nurse support and enhance the child attachment in their parents. The child health clinic BVC nurse roles is to support and encourage the child bonding to their parents. Parents need to feel that they are empowered in order to encourage the child to have a healthy connection to them, building and creating trusting a relationship with the parents, providing support for them in their new role as a parents, comprehensive knowledge about the needs and development of children, exceptional communication skills. Adolescent with endometriosis. There are 3 categories of reasons of excuse that the women identify as the reason for not participating: communication, treatment, and subterfuge. Applied to the EKO-Model, the women have to, the staff need to be professional treatment, respectful and sympathetic manner through the whole healthcare system, efficient organization, and clear communication. In vitro fertilization, the ability to reproduce and give birth to a child is an inherent part of life for most of human beings. Approximately 15% of couples of reproductive age have a difficulty in conceiving. Unsuccessful IVF living with large children have lower quality of life score. Quality of life appears to be independent of the outcome of IVF treatment as long as there is a child in the family. The adoption group have a higher psychological general well-being than other groups. Motherhood and type 1 diabetes. Motherhood and type 1 diabetes. The women's experience from an early study show that their health is low. Person-centered care was developed, and a web support self-care and self-learning was issued in the intervention. And the widespread sexual violence. Interview with the women from Congo, Kinshasa, who was abused, show that gaining resembling dislocated life, gaining back happiness will manage worries and shame, longing for an absent care, struggle in daily life. The EKO-Model, empathy, knowledge, and care. Through understand and training in the EKO-Model, the healthcare professional increase the ability to be sympathetic and empathic to patients' needs. Thank you.